Welcome to FNT, Functional Neurotalks, with the Precision Brain Center.
All right, welcome back to Functional Neurotalks. My name is Elena. This is Dr. Gabella and Dr. Blake. Today we will be talking about concussions. This is a really, really big subject. There are a lot of misconceptions, and I'm excited for us to clear that up today.
Yeah, we're excited to talk about this. I know a lot of people are very interested. I think the first question we're going to go over is concussion symptoms. Does that sound good?
Let's start even more basic with that and
Okay.
just what is a concussion?
All right, so concussion is anything that's going to cause damage to your brain in a mechanical sense. So you could have a bump on the head, or you could have a whiplash injury. So what that means, with whiplash, you don't necessarily actually have to hit your head. You're going to have a shearing force of the neck, and our brain is like jello, it's really soft. So it's going to accelerate, it's going to slam on one side of the skull, then bounce back, and it's going to kind of keep doing that until it settles down. But what that does is it creates an inflammatory response in the brain. We have this big cascade and different things that'll end up breaking down, and it leads to the symptoms. So typically we discuss concussion as a mild traumatic brain injury. So that term traumatic is what's fitting in the term that it's a mechanical action. We're actually doing something to bump our head or have a thrashing force on the brain, as opposed to what we consider an acquired brain injury. And so acquired brain injuries can actually have very similar symptomatology to what we consider a traumatic brain injury. It's just you get it differently. So an acquired brain injury would be something more like a brain bleed, okay? Sometimes people are walking around with like venous malformations and all of a sudden they rupture, right? Okay. And your stroke is going to fit in that category. And any type of bleed or loss of blood supply to the brain is going to be what we call an acquired brain injury. So today we'll just be discussing that realm of traumatic brain injuries.
Okay.
Yeah,
that really helps. So that actually does go over a little bit into the question I was about to ask with the different types of concussions.
Okay.
So for me, I personally don't know the difference between like a concussion and a traumatic brain injury. Is that the same thing, or?
It is. It is the same thing. So we typically would consider a concussion in the category of a mild traumatic brain injury. So you'll often see it as MTBI, and then you'll have just the traumatic brain injury. Typically with that, we're talking a little bit more severe, right? But either way, we're injuring the brain and we're changing the functional connectivity, and a patient is going to experience negative symptoms and neurological signs that limit their life.
Okay.
Yeah, and so in terms of category, that's an interesting topic because we try to create these, I guess you could say, categories to kind of put things in a nice little box. And it doesn't really work that way, but it's probably an easy, nice thing we can present and put a little bow on it to make it digestible for most people. So they like to look at concussions as 5 different categories, and they're in these categories based on what their primary symptoms may be, right? So we have the cognitive category, we have the headache and migraine category, we have the vestibular category, we have the ocular motor category, and then we have the mood and anxiety category. So what we're looking at with this is, so when I say cognitive, it's your ability to think, to process, retain information, have memory, to think sharply. Then when we talk about mood and anxiety, we're looking at the affect of somebody, how depressed, how anxious they are there personality changes, are there rage components, and so that's kind of in that category. And then we have the ocular motor category, which I love that they have this because so many concussion patients are really impacted with this ocular motor component. What it means, ocular motor. Ocular is eyes. Motor is our motor responsibility to move the eyes. So there's a lot of disruption and breakdown within the eye movement pathways, the control of gaze and looking at things. And that interacts with the vestibular system and balance, and really is a beautiful thing when it works well and tragic when it doesn't. Then we have the headache and migraine category, and we have the vestibular category. And so the vestibular is your dizziness, disequilibrium. Sometimes we can even overlap it with some of the dysautonomias and lightheadedness type of thing. But it is important to note that with all these categories, it is very rare that it is ever one category. And so the most commonality, if you don't have all the symptoms, you at least have several of the symptoms.
Oh, that's interesting. I didn't
Yeah,
know that.
and it's so important because the way the brain works is it's very rare that we have certain nuclei or structures that work in isolation. So it's a lot more likely that you have an ocular motor pathway that is also involved in your vestibular function or your ability to retain memory and to think sharply, right? So the same group of neurons are going to be carrying out so many things that may on the surface seem completely unrelated, but are very much overlated, and they're hardwired together. So it's a good take-home point. I do want to throw in a little bit about dysautonomia, and I think we're going to have a podcast at some point about dysautonomia. Yep. It's a huge topic today because a lot of people are suffering with it for many reasons. And it's hard to get treated, and functional neurology really does a great job with it. But the dysautonomia is that autonomic nervous system, and it's the controlled blood supply throughout the whole entire brain. And it is often seen in conjunction with two categories that we have already. So it's going to be that headache migraine category and then the dizziness category. And of course, with dizziness, it's a rare thing to see a patient that doesn't have those ocular motor findings as well. So yeah, that's a little bit of that, and that kind of gives you a clue into what the symptoms of concussion may be.
Yeah.
So
that's perfect, because that is the next question I was going to ask. What are some of the common symptoms that you will see? And then along with that, what are some symptoms that are a little bit residual that a lot of people overlook and don't even realize that they do have a concussion?
Perfect. All right, so Dr. Blake, I'm going to let you start this, and then whatever you don't cover, I'll wrap it in.
Definitely. I also just want to touch upon briefly that a lot of times people think that they need to experience symptoms right away after having a concussion, and that is definitely not the case. So usually you hear that symptoms peak within 24 48 hours after concussion, but that's not always the case. People may start to experience what we call a post-concussive syndrome, and you could experience that months or years later after your concussion, so people might not even associate the two together. As for the most common symptoms, a lot of people, like Dr. Gabella was mentioning, the ocular motor components, so that dizziness, a lot of times with that cognitive aspect of concussions. A lot of people say they experience the brain fog, trouble thinking, recalling, short-term memory. Some people may even experience vertigo. I know myself, I didn't experience vertigo with my concussion. I had no idea that was a vestibular component for symptoms, which is kind of what got me into the whole functional neurology field.
Yeah, that is an important thing to note, that our brain is meant to compensate really well for us because we have to function good in our world even if things are dysfunctional, right? So there are lots of patients that will have a significant vestibular imbalance, and they won't actually experience what we consider vertigo or dizziness, and yet, we pop on V&G goggles and they just got crazy nystagmus all over the place. So it is a good distinction to point out.
Good point.
And then finishing up with some of the concussion symptoms that you potentially will feel. Sometimes you'll see some sleep changes, whether it's difficulty falling asleep, difficulty staying asleep. Sometimes it's something as simple as being like, I do not feel right, like I feel off. As Dr. Blake mentioned, a lot of that brain fog, the cognitive slowing, decreased attention and focus, and I'm sure you know a lot of people that have that. As I'm kind of relaying this off, we have a concussion symptom checklist. So these are literally on the checklist. So difficulty remembering, feeling confused, irritability is a big one, is a very serious one, and should be treated. You don't want to leave that stuff untreated. Anxiety, depression, head pressure, headaches, neck pain, blurriness or blurry vision, dizziness, balance issues, things like that. So these are all symptoms, and you could also get so many other symptoms like dissociation, and
that's a good one.
the dysautonomia components, getting lightheaded when you go from sitting to standing, a lot of personality changes, things like that. So just about any neurological symptom could end up being yours after a concussion. The reason being is that when we injure the brain in a mechanical way, like we discussed earlier, a a lot of our symptoms or a lot of the presentation of the damage afterwards, after that inflammatory cascade, is going to be dependent on what our baseline brain function was prior to the head injury. So if I am in a motor vehicle accident and I get the whiplash injury or I bump my head in the car crash, right? Whatever was happening in my brain prior to that, my baseline, which is almost guaranteed to have some sort of dysfunction just because of the way we live nowadays. We live in a world that is not necessarily the most brain friendly. My areas of weakness are going to have the highest probability with being dysfunctional or being affected by the inflammatory response. The other thing we know to be true based on the research is that the areas of the brain that are most metabolically active have a higher probability of being affected by concussion, because metabolically active means it fires more, it requires more blood supply, more oxygen, and more glucose. So that means anything that is happening systemically, like an inflammatory response, is going to impact it. It's going to be your cerebellum and your midbrain, mesencephalon, basal ganglia area. They're very metabolically active. They're involved in almost everything we do as humans, and we do know that beautiful cerebellum is so densely packed, it actually has more neurons in it than the whole entire cortex. So we know it does a lot, and it's a powerhouse, so that's a big area. And that's also the area we're going to see involved in a lot of the ocular motor control and a lot of the dizziness and the balance issues and things like that.
Okay.
Yep.
So then, depending on the injury too, like where they had the most impact, it will also affect their like symptoms as well. Is that correct?
For sure. Doesn't matter where you bump your head, though. A lot of people think, hey, I hit this side of my head. It must be this side of my brain that is impacted the most. And that's not the case, because we've got to go back and think about what is the brain. Like, we like to think about the brain as this nice, solid structure, but it's not. Like, if we dissect a brain, we've already had it lots of formaldehyde, it's been preserved, and it's now this nice, firm texture. A fresh brain is like Jell-O that does not hold shape. Like, you have to put it in a mold, and the mold will hold its shape. So it's so soft. Those tracks, those neurons are so soft. So basically, it's this Jell-O floating outside this very hard skull. So when we're having that, if we hit our head one way, the brain is going to bounce, hit the back, hit again, hit again, hit again, hit again. And what's happening with those hits is a shearing force that happens, and you create this massive inflammatory response, right? So unless there's actually a brain bleed or hematoma on that area, now in that scenario, it's totally different, because then we're causing compression, we're causing specific loss of blood supply to a specific area. Those cases where brain bleeds, it is going to be specific to the site.
Okay.
When we're talking about typical mild traumatic brain injury, which is not a brain bleed, right? A concussion. We're talking about a global systemic reaction, and where things are going to break down are going to be dependent on the patient, right? And we see these beautiful commonalities, and maybe this will be an easy way for people to really grab onto why there's so much overlap in the brain, and why we have neurons that are involved in cognition that are also involved in my level of anxiety, and also involved in my level of dizziness, and also involved in my level of eye movement control. And why do we have it that way? So when we're looking at concussion symptoms as a whole, these are going to be pathways that are the strongest and that are the most complex and that fire to the most areas of the brain, right? So the probability of breakdown is going to be the most connections we have a higher probability of being affected. An area that's very specialized and has small connections is going to have a less probability of being affected. So when we look at these symptoms, we're actually looking at, hey, these are the areas of the brain that are so important and fire to almost all other areas. Specifically, when we're talking about eye movement control, it's really mind-blowing at how these areas and pathways fire to almost all other structures of the brain that control everything about us as human beings, right? So yeah, my ability to move my eyes is also connected to my personality and my ability to process and perceive the world and articulate, something that I'm thinking in my head. It's all interconnected. It's pretty cool.
Yeah, super interesting.
I also just want to add in too, I think Dr. Gabella touched on it a little bit, but when it comes to location of where you hit your head, you don't necessarily have to hit your head. Nope. So a lot of people think that, they tripped and fell, but they say, oh, well, I caught my head, it was cushioned by my hand when I fell. That doesn't necessarily mean that you may not have a concussion. Like Dr. Bella was saying, that acceleration, deceleration force is really all it needs to have a concussion.
Yep.
Yeah,
Absolutely.
good point. So you said that you had a concussion.
Yes.
Do you mind telling us a little bit about your experience with it?
Yeah, definitely. Get ready for a long story. No, I'm kidding. So I was a very active athlete in high school and college. I did competitive ski racing. I played soccer in college. And it wasn't until post-college that I started to get symptoms that I had no idea were associated with concussions. So like I was saying before a little bit, I was experiencing vertigo. This was months after I had a very minor concussion. This was before I really knew about the realm of functional neurology. So I was associating with the fact, oh, it must be something to do, with my hormones or something. This can't be associated with concussion because, the last one I had was so minor and it was months ago. This can't be, connected in any sort of way. It wasn't until I saw my first functional neurologist that they said, oh, so your brain was just really, really good at adapting and you've had almost 10 concussions by now. You finally hit that stress or that one last thing that just set your brain over the edge, and now you're starting to see all these symptoms arise out of nowhere of what felt like it was nowhere, when in reality it was from all this building up of past injuries that I haven't treated before. I never saw anyone, I never did anything. I just kept doing my thing, but I also kept getting more stress. As you're getting older, adult life is stressful, so just more and more adding on to it until, I hit that final straw, and then all the symptoms came in and it just felt overwhelming. This came out of nowhere, but now I know it makes sense. This is what it caused it. And ever since, I got treatment. Haven't had vertigo, so it really, really helped me get my life back.
And that's a really important point for people to understand, because it happens almost all the time where patients land in our office and they sometimes have no idea what brought on their symptoms, right? So they're like, I was doing okay. They don't even have like a memory of bumping their head, right? So just out of nowhere, they're doing something. It could be movement induced. They could have been doing yoga, or they could have just been sitting at a computer, and then this whirlwind of symptoms just come on all at once. And so they think, oh my gosh, it feels like it's a life or death scenario, and they go to the hospital, they go to their primary care, they go to the neurologist, they go to all these places, and they're ruling out if there's ablative pathology, and generally they're like, you look fine, MRI is great, everything looks good, and yet they can't function in the world anymore. So important thing to know is that our brains have to be really, really good at compensating for us, because our brain is everything, right? If my brain doesn't work well and doesn't compensate for me, I can sit in a room and I don't understand what anybody is saying to me, or I try to get up and walk down the hall and I bump into the wall, or I trip and fall, or and risk of fall are a really big thing. But so the point is we could have all these insults, and insults come from a lot of different places. It could be lifestyle choices. A lot of alcohol, binge drinking is not good for you. Recreational drug use is not good for you. Poor diet is not good for you. We have some upper respiratory infections that will pass the blood-brain barrier. Some of them even lay down in the cerebellum area and then become active, later on. We've obviously got concussion. We have pollutants, lots and lots of pollutants. So I do suggest it's a really good idea to start checking ingredients. Probably start with like household cleaning products and things like that. There's a lot of toxins in there that are very unnecessary for us to even have. We have pollutants that we inhale, right? So we have all these insults, and we can't just step outside and breathe in pollutants and then all of a sudden go crazy and lose our mind or like step into depression. So our brain has to have this really great mechanism to compensate. So we do that, and as I injure these different areas of my brain, I'm going to recruit in healthy areas to carry out the job, but it's going to be very inefficient. It's going to require more oxygen and glucose, and it's not going to do it well, but my brain's still going to try that compensation. And I'm going to keep doing that until the very last insult on my brain happens. So now I've got all these overcompensated areas, have this last impact, and have nothing healthy and strong enough to actually come in and compensate and carry out this new lesion, right? Carry out or compensate for this new lesion. So all of a sudden, sort of like the floodgates open, and all symptoms come rushing to the surface, and it's scary. So if you are somebody experiencing that, know that you are not alone. It's a very, very common thing, and you can absolutely be treated. It's really important to look to see what functional neurologists are in your area. I'm sure we will share the website link of a doctor locator to help people kind of find. And because there's not a lot of us, we often treat intensive out-of-state patients for that reason. So that is important to note. We try to give you a lot of resources so that you can do things at home to get better, but it doesn't always work that way. So it is good to, if you can, go see a functional neurologist, get treated. A lot of times it doesn't matter if you're from a different state, they'll see you and they'll see you multiple times a day.
Nice.
Yeah.
Okay, so thank you for sharing that, Dr. Blake.
Of course.
Yeah, that sounds like a lot. So how does functional neurology treat concussions? We were mentioning that functional neurology, well, going to a functional neurologist is a really great way to get treated. So how do you go
Would
about
you like
that?
to answer that? You want me-
Yeah, definitely. I know for me right away, it was my first exposure. I had no idea what was going on. Now I understand. I'm like, okay, this all makes sense now. But it's really, really individualized, and I think that's what makes functional neurology so amazing because, it seems like very simple activities you're doing in the office. And then all of a sudden I know from a perspective as a patient, you just notice your symptoms slowly going away. And it may not be something you notice. It could be, oh my gosh, I can sleep through the night now.
Yep.
haven't been able to do that in months. Or it's like, wow, this usually stresses me out. I'm not able to function for the rest of the day. Now I feel totally fine. I'm able to do this without experiencing any symptoms.
Right.
So it's really, really interesting just from, you go do a physical examination, go run a VNG, track eye movements, and then you can see get a good picture of the functionality of your brain, and it's just amazing, to see everything just happen from there.
Yeah, for sure. And so the idea of functionality is we do a extensive examination, neurological examination, and we're saying what is going on in this patient's brain, right? We're saying what areas are dysfunctional, aberrant, abnormal, and then what areas are doing well. And so there's so many cool tests we can do just by the bedside. Like you can be looking at a patient's eyes, looking at all these different autonomic responses, lots of observational stuff. We can do fine motor skills with different finger tapping, your ability to walk, right? Our gait, arm swing, stride length, heel strike. Our ability to stand upright, right? To stand with our feet together, eyes closed. Do we have a sway pattern? Do we fall? Do we have limbic escape? Am I sitting here and I just bust out crying for no reason? Or do I laugh? Is there a pseudobulbar palsy? So there's all these different expressions of human function and brain function that we need to grab onto really quickly and say, okay, what's going on in this patient? Do they have any weird non-volitional movement, right? Do they have a tic or a jerk or myoclonus? And we make note, where is it at? Is it upper extremity, lower extremity? Is right, left, is whole body? What are their reflexes like? Is there spilling? Do they have reflexes? What's their sensory integration, right? Do they feel things side to side? Does it feel different from side to side? Is it dull? Is it increased? So all this is painting this beautiful picture of what's going on in the brain. And so then we move on to like VNG. And the VNG is mind-blowing. It's really incredible because we have this beautiful research about neurology and eye movement control. So it's quantifiable, it's you can't deny it, it's not pseudoscience, it's valid, concrete, and we can hang our hat on it. So we do these measurements, we get biomarkers, because when it comes to eye movement, we have a few eye muscles, right? Very few compared to how many muscles we have in the body. So if we can quantify those eye muscles and they're involved in so many other things, we can say, okay, so maybe the frontal eye fields or the dorsolateral prefrontal cortex of the brain are not doing well, Maybe the superior colliculus is not doing well. Maybe the pons or the midbrain is not doing well. So as you can see, all this stuff that happens within like a 2-hour window, it's giving us this beautiful information that's saying what's going on in this patient's nervous system. So often we say, oh, we're going to get all the information from the comprehensive neurological exam. And people are like, what does that even mean, right? It's because people are they're used to going into very brief exams where the provider's really not touching them so much. They're not really hands-on. Well, that's not the case here. We're doing a lot of in-depth things, and we're doing it so we can say, this is exactly what's going on in the parietal lobe. This is exactly what's going on in the basal ganglia. We kind of hang our hat on it, right? And so then we get to the treatment part. And this is the beautiful part, and this is where it gets a little bit more creative, because we have all these textbooks that say, okay, if we activate this pathway or this cranial nerve with this type of stimulation, it should have this consequence. Well, that doesn't happen all the time. So that's where you get creative, because every person is so very different. And so it's super important that when we are treating a patient, we're constantly re-examining. We're saying, is this getting better? Is it getting worse? Is there no change at all? And treatment is always modified to just target things. And so really quickly, we are able to see a patient get better, but also say, this is perfect. This is a good game plan. Yeah. And so the types of functionality treatments, people ask this all the time, and I'm kind of like, I don't think we can simplify it anymore because it is so complex, but just a little bit is sometimes we lose electrical stimulation, and we'll pop it on the face in different areas, and these are large pathways, huge nuclei that run to a lot of places in the brain because it's the cranial nerves. Or maybe we need to increase more parasympathetic tone. We can activate the vagus nerve. We use a lot of eye movements, and the eye movements are going to be very specific to the patient in the plane with the right type of movement, whether it's a saccade, which is a fast movement, whether it's a pursuit, whether it's a volitional eye movement, whether it's a reflexive eye movement, whether it's 10 degrees, whether it's 30 degrees. It's very specific to the patient. And yeah, we do all this stuff, and we do it in combination because the in combination gives us this beautiful multimodal effect. So we get faster neuroplastic changes, positive neuroplastic changes, and things get wired together, and we create this awesome accuracy, and then people feel so much better. And I wish I could summarize it better, but there is no way. It's hard to make it simple. If you become a patient, you totally get it. You're like, okay, I understand it. But yeah, I'm doing my best. I promise we're not making anything up, and we're not holding anything back. But it's complex, and we can do a lot of things. It's not cookie cutter at all. Like every patient is truly treated very differently, and we use different modalities, and yeah, it's cool.
Yeah, one thing I wanted to add with the initial exam you guys do, it's so crazy, but so incredibly cool seeing people connect the dots with all these symptoms that they didn't even know were connected. And then if you do, after that exam, you explain to them everything that goes on. You're like, well, this is why you've been feeling so anxious. It's because of this. It's crazy because you get to pinpoint exactly why they're feeling the way they do, which you don't get that from anywhere else.
Right. Yep. And it really helps, because I think a big part of this is understanding, why am I feeling this way? Like, where is this coming from? And then being able to say, this is how I can fix it. Like, this is not a Band-Aid. The reality is I could truly rewire and change my brain. It's really amazing.
Yeah, that's huge.
It is.
Yeah. So one other question I wanted to ask you guys really quick. What happens when concussions go untreated?
Yeah, it's not a good scenario, that's for sure. Do you want to finish this one?
I can definitely touch on it, since I think I did a little bit with my own situation. I went untreated for years, and I think my very first concussion was in middle school. I was unconscious for a few minutes. And this is before there was concussion protocols. Woke up, and that was my first concussion. And then through the years, I've gathered many more that went undiagnosed. And, that's not to say that people who have a concussion aren't going to live a beautiful, healthy life if they didn't get treatment. Yeah. That's definitely not the case at all. So when it comes to my situation, I didn't get treatment, and then it came to this one stressful scenario with this one stressful day that everything just kind of fell apart. So that's kind of what we see in the office, that patients, they don't necessarily have a bad head injury. They may come in right after the concussion because they think, this was a really bad one, or I'm experiencing a lot more symptoms than usual. I think something else is going on. Or they, had a concussion years ago, aren't associating the two, and now the symptoms are showing up. So you may be experiencing, cognitive changes, emotional, vestibular. It can be definitely a wide spectrum of symptoms you can experience. Not every brain is the same. Right. So it's going to be very, very different. It's hard to say what exactly will happen, but we're also not saying in the fact that if you don't come get treated, something bad's going to happen.
Right. Yeah. There's plenty of concussions that don't get treated and they feel fine, right? Because their brain is still doing a really good job at compensating for them. Just the important thing to know is when it is left untreated, you could end up having persistent long-term symptoms, because unfortunately, we do live in a world where just lifestyle stuff is a little bit rough on the brain. Like, we're kind of like a go-go lifestyle. We don't really take that time for mindful breaks and just kind of calming down. We're in, this overstimulating bright lights 24/7. So little things have an impact on your brain. And so if you have areas that aren't working well, life just gets harder for you. It's harder to focus. It's harder to retain information. If you want to learn to play a guitar or play a new sport, it's going to be a little bit more difficult to learn new things. And then the biggest risks is, you go on compensating without knowing that you have dysfunction, and then all of a sudden that last incident happens that brings everything to the surface. So, brain optimization is a really, really good, it's a hot topic, but it's a really good thing to utilize if you were an athlete and had concussions, and even if you're not symptomatic, right? If you want to be performing at your highest level and reach your highest human potential, getting your brain checked is huge, because you don't necessarily have to have symptoms to have that stuff going on. And then obviously the scary end of this conversation is the concern of multiple concussions resulting in CTE, so chronic traumatic encephalopathy, and that really can't be diagnosed until after death, and we take an autopsy of the brain and take a look and see what's going on. But what that means is we have consequences to these things, right? So it could be a concussion, it could be a pollutant or toxin, but every time we're exposed to this and we have these inflammatory reactions, our brain needs to try really hard to get rid of the garbage and debris that builds up. And that garbage and debris is what we call protein tangles. So when we look under electron microscope and we're looking at what this is, there are these protein buildups that wrap and create tangles within our neuron networks and result in devastating things like neurodegenerative disorders. So we have the class of tauopathy and alpha-synucleinopathy and beta amyloid, just naming the type of proteins. And on a side note, I think I've brought this up before. I don't know if it's just with patients or in a podcast, but I'm gonna repeat it again. We used to think this stuff didn't really impact people until way past their 30s. So we used to think of it as a later stage in life, right? That the protein tangles would be laid down, until this really smart researcher went into Mexico City and decided, hey, we have all these children that are dying very, very young. Why don't we use this for research purposes? Why don't we look at their brain and see what's going on? And so these young kids, 8 years old, they go in and they're autopsying the brain, they're looking at what's going on, and all of a sudden we see tons of these protein tangles. And we see the beta amyloid and tauopathy and alpha-synucleinopathy, things that we did not think presented until later stages in life. And what those things result in, they result in dementia, they result in Alzheimer's, they result in Parkinson's disease, they result in cortical basilar degeneration, they result in your progressive supranuclear palsy, this scary, bad stuff that nobody wants. They result in chronic traumatic encephalopathy, right? So, yeah, not to scare anybody, but, the brain is really important. It's really cool. It's a cool thing to make wise brain choices. It's a cool thing to not want to binge drink all the time. It's crazy. That's a bad choice. We've all done it. We're all young, and then all of a sudden you get in your 30s and all of that stuff adds up. So it's super important, and we love the brain and we cherish it. We know how important it is, and we are happy to share it with you guys. Yep.
Yeah, I also just want to reiterate too, a lot of people may be under the conception that, they had a few hits to the head, a few concussions, and this is their new normal. I want to say that it's also very possible to have even better baseline than before if you come see a functional neurologist.
Right, absolutely.
It's very, very possible. We see it all the time when it comes to patients. So.
We do it all the time. Yeah. We very often make patients way better than before their last head injury and things like that. Yeah, so it's pretty cool.
Yeah. Well, that's all I have for you guys.
Okay.
Is there anything else that you'd like to add before we finish this off?
I think that's everything.
I think I'm good.
Well, if you have any questions regarding concussions or anything else, please let us know. But yeah, I guess that sums it up for today. Thank you for listening in. Again, my name is Elena. This is Dr. Gabella and Dr. Blake. And we'll see you next time. Bye.
Thank you, guys.
Thank you.
We hope you enjoyed today's episode of FNT. Please like, follow, and subscribe to our show, and don't forget to check us out on social media. If you or a loved one are seeking treatment, please visit us at precisionbraincenter.com.